Welcome everybody to this webinar of the Missouri Veterinary Medical Association. The title of this webinar is An Introduction to Mental Health for Missouri Veterinarians. It's a product of our MVMA Wellbeing Task Force, whose chair is Dr. Abby Whiting. And today we've got two speakers with us, Dr. Carrie Carafa, a licensed psychologist with a PhD, and Dr. Joan Coates, DVM, MS, Diplomat ACVIM in neurology, both from the University of Missouri College of Veterinary Medicine. And with that, I'm going to turn it over to our two speakers.
Hello, I'm Dr. Joan Coates. The objectives of this presentation for today are to provide an overview of mental health challenges facing the veterinary profession, identify potential signs of a mental health problem, and introduce mental health support and treatment resources. Mental health issues are medical conditions that disrupt a person's thinking, feeling, mood, ability to relate to others, and daily functions. Approximately 1 in 6 adults experience a diagnosable mental health problem, but the majority of those in distress do not seek support from a mental health professional. Supporting positive mental health will allow us as veterinarians to maintain a high standard of care. We know from recent literature that veterinary students and professionals are at risk for mental health issues. These include depression, anxiety, substance use disorders, suicide, burnout, and compassion fatigue. In a 2015 study published in JAVMA, the authors found that 7% of male and 11% of female veterinarians reported current serious psychological distress, compared with approximately 4% of men and women in the general public. They also found 25% of male and 37% of female veterinarians have experienced depressive episodes since veterinary school. Furthermore, 14% of male and 19% of female veterinarians have considered suicide since graduation. This is 3 times higher than the U.S. national average. They also found similarly that 1% of male and female veterinarians have attempted suicide since completing veterinary school.
This is Dr. Carrie Carafa. Research suggests that veterinary students are also at risk for mental health issues. In a recent study of 573 students sampled from 17 colleges around the country, over 1/3 reported experiencing clinical levels of anxiety and depression. 25% had scores at or above the cut score for detecting alcohol use disorder. Almost a quarter reported engaging in non-suicidal self-injury, which was defined as cutting or burning. 30% reported having seriously thought about killing themselves at some point, and 5% indicated that they had made a suicide attempt at some point in their lives. Despite these issues, there tend to be discrepancies between the published risk of suicide and other mental health issues for veterinarians and their own views of their risk. This suggests an inadequate awareness of mental health vulnerabilities. For example, Skipper and Williams found that 27% of female veterinarians and 20% of male veterinarians had seriously considered suicide at some point, but only 11% of the sample believed that suicide among veterinarians was a significant problem. In addition to these discrepancies in awareness, there are several other barriers that may interfere with veterinary professionals seeking mental health services. For example, individuals in distress may not seek help because they have difficulty recognizing signs and symptoms of mental health problems. They may be unsure about the effectiveness or the efficacy of mental health services. They don't know what services are actually available, and they're concerned about stigma.
To tend to the first barrier regarding awareness, we will share potential signs of distress. This is by no means an exhaustive list, but these are some of the common experiences for a person with mental health issues. The first includes emotional signs, such as irritability or anger, feeling of hopelessness or helplessness, persistent sadness, mood swings, and feeling on edge. Cognitive signs include racing thoughts, confusion or indecision, impaired memory or inability to concentrate, self-criticism, excessive worrying, and thoughts of suicide or death. Behavioral signs include frequent crying, social withdrawal, lethargy, increased drug or alcohol use, difficulty completing tasks, and missing appointments. Outward physical health signs include sleeping too much or too little, problems falling asleep, fatigue, muscle tension, changes in appetite, or sex drive.
Importantly, mental health services have been shown to be effective for treating a variety of mental health problems. Many people can also benefit even if they're not experiencing a diagnosable mental illness. For example, if they're wanting to improve assertiveness or conflict resolution skills, if they're feeling stuck in an unhappy situation, or if they're wanting to improve self-awareness and emotional intelligence. Many of these issues are things that veterinarians would encounter in practice on a daily basis. Also, most people experience improvements in symptoms and overall functioning within brief treatment models. For many people, making sense of mental health provider credentials can be a little overwhelming, so we want to discuss this briefly. Licensed mental health professionals all hold graduate degrees and have received postgraduate supervision in providing clinical mental health services. They're trained to evaluate a person's mental health, make appropriate diagnoses, and provide treatment using a variety of modalities. Here are the most common mental health provider credentials in the state of Missouri. Licensed professional counselors, or LPCs, hold a master's degree or higher in counseling, psychology, or related area. Licensed clinical social workers, or LCSWs, hold a master's degree or higher in social work. Licensed marriage and family therapists, or LMFTs, hold a master's degree or higher in marriage and family therapy, counseling, psychology, or related area with specialized training in family therapy. And licensed psychologists hold a doctoral degree, either a PhD or a PsyD, in an applied area of psychology, such as clinical psychology or counseling psychology. Psychiatrists are licensed physicians who have a doctoral degree in medicine, either an MD or a DO, and they have completed postgraduate residency training in psychiatry. Of these providers, psychiatrists are the only ones who are able to prescribe medication.
Finding a mental health professional can also be a challenge. There are several avenues for finding a professional to help. These may include insurance panels, your primary care physician, state association websites, online therapy finders, and also referral from friends.
When searching for a mental health professional, there's several factors to consider. Research actually suggests that treatment success is impacted more by the client's fit with the therapist rather than the therapist's specific credentials. So what is a good fit? Well, you want to look for someone who has experience working with your presenting concerns and familiarity with the issues that are most important to you. Someone who practices from a therapy approach that matches the way you see the world, and someone who you can feel safe and understood by. It's totally okay to shop around. Realistically, it could actually take a couple tries before you find the right fit, but in the long run, it'll be worth it.
There are many nationally recognized mental health resources available online. These include the AVMA Wellbeing and Peer Assistant Resources, the National Institute of Mental Health, NAMI, or the National Alliance on Mental Illness, and the National Suicide Prevention Lifeline. There are also several helpful online tools for finding a therapist. These include the Therapist Locator and the Psychology Today Find a Therapist.
As we work to improve mental health and well-being in the veterinary profession, there's several things we can do as a community, including openly talking about mental health in the profession, which may reduce stigma and improve attitudes towards seeking help when it's warranted, learning about mental health topics and resources that are available for ourselves and others, striving to attend to our own well-being, helping to create a healthy workplace and supporting others in that process, and checking in with others who may be in distress and then helping them connect to resources.